Forget to like and subscribe. 6 weeks pregnant, your little one is developing new features. This week's most important milestone, the neural tube begins to close over what will become your baby's spinal cord. There's more. This week, the areas that will become the eyes and ears have started to project as bumps, and other tiny buds are forming that will eventually grow into arms and legs. A heartbeat of about 105 beats per minute may be detectable in an ultrasound this week, and the brain and nervous system are also developing quickly. In fact, the nose, mouth, and inner and outer ears are just starting to take shape, along with the lungs. In just a few weeks, breathing tubes will form between the throat and the lungs, getting ready for your little one's first breath of air, and maybe a loud wail, at birth. The size of the embryo at 6 weeks pregnant. At 6 weeks, your embryo measures an average of 0.08 to 0.2 inches, about the size of a pomegranate seed. Take a look at the visual below to get an idea of how things are progressing inside your belly. At 6 weeks, when it comes to the embryo, it's not unusual to see some spotting at 6 weeks, but it should be light, not even enough to cover a small pantoliner. This implantation bleeding is normal, but if you see a lot of blood, if the spotting lasts longer than 2 days, or you have any concerns, be sure to see your doctor right away. Cramping. At 6 weeks pregnant, slight cramping can be normal. It's a sign your uterus and the surrounding tissues are expanding to make room for your baby. If you feel pain more severe than usual period cramping, if accompanied by a fever or diarrhea, contact your doctor immediately. Morning sickness. If you haven't yet had morning sickness, this may be the week it arrives. Morning sickness can happen any time of day or night. It may be triggered by certain movements, smells, an empty stomach, or nothing at all. Crackers and other simple, starchy foods can help those random bouts of nausea. Exhaustion. You may feel completely exhausted due to pregnancy fatigue, and that's okay. As your levels of the pregnancy hormone progesterone are increasing, making you more and more tired, you may find taking naps can help. Some women also say that little snacks and some light exercise are effective in fighting off fatigue. Ways to help yourself feel a bit better. No symptoms. That's right, it's possible to be 6 weeks pregnant with no symptoms whatsoever. Every pregnancy and every woman is different. For example, some women never experience morning sickness.
Fascinating topic. Intro. While I may not have experienced pregnancy firsthand, I've had the privilege of witnessing this incredible process twice in my life. The sheer marvel of it is beyond words. My aim with this video is not to dwell on the negatives, but to shed light on some commonly experienced symptoms of pregnancy. In future videos, we'll explore the many beautiful aspects of pregnancy. First on the list is morning sickness. Contrary to its name, it can occur at any time of day and isn't obliged to vanish post-lunch. Although the precise cause remains elusive, the hormone HCG, likely HCG, or human chorionic gonadotropin, doubles every 48 to 72 hours during the first 12 weeks of pregnancy, peaking and then declining. Higher levels may indicate multiple pregnancies or issues like Down syndrome. While most experience relief by weeks 12 to 16, some endure severe morning sickness throughout, known as hyperemesis gravidarum, which poses serious challenges. Moving on to fatigue, progesterone, and its metabolite, allopregnanolone, are key players. Progesterone levels rise steadily throughout pregnancy, contributing to drowsiness due to enhanced responsiveness to the neurotransmitter GABA. Fatigue tends to ebb in the second trimester before resurfacing in the third, influenced hormonal changes and the physical and emotional toll of pregnancy. Another common phenomenon is changes in taste, often characterized by a metallic or bitter flavor. While the mechanism isn't fully understood, estrogen likely plays a significant role. Pregnant individuals, particularly females with elevated estradiol levels, report alterations in taste perception, affecting food preferences. The third trimester brings physical discomfort as the expanding uterus displaces surrounding organs. The greater omentum, intestines, stomach, liver, gallbladder, and even the heart and lungs undergo significant shifts to accommodate the growing fetus. While these changes are awe-inspiring, they undoubtedly contribute to discomfort. There are numerous other transformations in a mother's body during pregnancy, including